My name is Dr. Baheti. I'm a vascular and interventional radiologist at Sound Vascular. I'm here to talk to you today about uterine fibroids. Uterine fibroids are benign tumors that grow inside a woman's uterus. They grow for all sorts of reasons: hormonal, hereditary, age-related, medicine-related, but they can become large and bulky and cause all sorts of symptoms for different women. The most common symptoms of uterine fibroids are heavy bleeding, bleeding between your periods, menstrual cramps, pelvic pain, or pain during sex. These are all common symptoms we see for women with uterine fibroids. Some women have severe enough bleeding that they often require blood transfusions or iron supplements to treat. That is not normal. If you are having that sort of heavy bleeding, perhaps we can offer you an alternative treatment called a uterine fibroid embolization. Can fibroids turn cancerous? No, fibroids are benign tumors, which means they have no cancer cells in them. They just tend to grow, sometimes as we age, up until the time of menopause, at which point they start to shrink. Can stress cause fibroids to grow or worsen symptoms? Stress can cause fibroids to grow. It's more common that the fibroids will start growing kind of as a patient gets closer to menopause, at which point they will start to die off. Fibroids can also grow during a patient's pregnancy or if they start any certain types of medications. How are fibroids diagnosed and what treatment options are available? Fibroids are typically diagnosed using imaging. Oftentimes we start with our first-line imaging, which is ultrasound. A pelvic ultrasound is a non-invasive imaging technique that we can use to detect if a patient has fibroids. Fibroids can also be picked up on other types of scans, such as CAT scans and MRIs, and they may be incidental findings if you get a scan for something else. What treatment options are available? There are many different treatment options available to treat fibroids. The most common treatment option for fibroids is something called a hysterectomy, where the entire uterus is removed. Other minimally invasive surgical options include a myomectomy, which is where just the fibroid is removed surgically. I also offer a procedure called a uterine fibroid embolization. What is a uterine fibroid embolization? A uterine fibroid embolization is a non-surgical, minimally invasive procedure that can be done on an outpatient basis to treat symptomatic uterine fibroids. A uterine fibroid embolization is a simple, non-surgical procedure that can be performed on an outpatient basis using a tiny hole either within the wrist or within the groin. What we can do is take a very small tube called a catheter into the arteries that feed the uterus and block those arteries off using a combination of small plastic particles or beads, and we just block them off. Uterine fibroid embolization is a non-surgical procedure, a minimally invasive procedure that can be done in the office in the outpatient setting. Usually we go in through the patient's wrist artery or the artery in their groin near their hip and take a very small plastic tube into the arteries that supply the uterus. At that point, we can inject material to block off those arteries and thereby stop supplying the fibroids. Then the fibroids start to shrink on their own, and the patient's symptoms of bleeding or bulk pain or pelvic pain start to decrease. How does UFI compare to traditional ostoms like hysterectomy? One of the benefits of uterine fibroid embolization as compared to traditional options like hysterectomy is that this is a uterus-sparing surgery. The patient keeps their entire uterus and we do all of our procedure through a tiny hole from the inside out. Additionally, there's almost no downtime. There's almost no surgical incisions for the procedure. How do you decide which treatment is right for me? Patients should be presented with all their potential options for treatment for fibroids, including uterine fibroid embolization. It's just one in the line of many different things that we can treat here at Sound Vascular Vein. To find out more if this procedure might be right for you, contact us at Sound Vascular Vein.